So welcome everyone. Thank you for attending that webinar today. The idea is that we're gonna explain a bit of describe what our MSc in House Data Analytics is, why it came up, and what you're gonna be doing when you enroll the course. So today we have Thomas Wright, who's a former student of this course, who's also a PhD student, also our uh, course organizer and teaching fellow. He's another face of the course. And so basically, we're going to go through a short presentation where I'm really just going to introduce the concept of the course, the rationale of why we developed it, then go delve into the details of what it contains and how it's organized. And then you will have the opportunity to ask your own questions. There's a Q&A session on the Zoom call, and Thomas will kindly read them out, and we're gonna answer those. Also wanted to thank Joe and Sylvia, who are also core in the course team, who organized this call and the seminar, and they're behind the scene also addressing some of those questions. Now, before I start, Thomas, maybe you want to say a couple of words of who you are, why you're there, and yeah.
Yeah, would love to. So as Mark mentioned, I am a past graduate who loved the course so much, I decided to stick around and do my PhD with Mark, which I am wrapping up shortly. And I'm also the teaching fellow. And so what that means is that I oversee the teaching. I'm kind of a touch point for you guys, and make sure that the year goes as smoothly as possible. Um, yeah, as I briefly mentioned, it's a really fun program. It's really interesting and it's really transferable, translatable. I love teaching, and so that's why I've stuck around to help out as much as I can. So hopefully you'll sign up so that we can work together next year. So I'll turn it back over to you, Mark.
Thanks, Thomas. And just also to mention that there's another teaching fellow, a senior teaching fellow, Sabrina, who's currently on maternity leave, but returning very shortly. So you will be also get to know her, and she's also well. They work very well with Thomas in making the interaction between the students and the teaching team very, very dynamic and fruitful. So that being said, let's go to the beginning of the story. So the we developed this program 8 years ago, and it came from the observation that there was two communities that were not talking together enough. The communities that we were thinking should be working more was those more on the analytical side, in the statistics, ML side, developing interesting and very, very novel algorithms on one side, and the other population that should talk to them, we thought, was more the scientists generating data on health and health quality. And so the idea is that we really wanted those two communities to work together because there are some very, very pressing research questions and research needs to be addressed around health quality and health data. And with the emergence of that huge amount and huge volume of data, we need proper tools to explore in an interpretable, reproducible, and actionable way these data. So the idea was to really, if you want, in one side, extend the use of advanced analytics approaches, borrowing from statistics, machine learning, and more recently AI, so that these algorithms could be fruitfully and meaningfully used in health sciences. So that's the first objective. And then the second objective that we had was to make sure that knowledgeable students with a theoretical background or in quantitative sciences could come to that big community of health data science and make their own path in this community, which requires those skills to answer these questions. So basically, getting those two communities working together, and that is what we thought was came up with a definition of I would say, our unique culture in big data analytics for health sciences. So this is really our DNA, making those two communities work together with the same objective, which is better health and data-informed decisions. So based on this, we have a target audience, which is very, very easy to understand now, which is strong students with a methodological background, either in mathematics, statistics, sometimes physics, who are willing to move to a more applied field, that of data science. And on the other side, we also have strong students with more of an applied background. So they could be in epi, they could be in molecular epi, they could be medical doctors, they could be pharmacists, they could be biologists who are really willing to go a bit beyond getting data generated and kind of take ownership of this data and of the analysis of these data. So people that are very, very data aware so that they can be doing independently and robustly and rigorously their own analysis of the data they know the best. So basically, based on these two communities that we're putting together, we're implementing a very, very collaborative and cross-fertilizing research environment within the program. And again, I keep on putting that motto at the end of this slide, which originally came from a joke that we had with Thomas, but it's actually really what we want. We want to train experts and not nerds, in the sense that we don't want people that know everything about every single possible algorithms, but we want to have people that are intelligent and literate enough to be able to say, okay, I've got this question. This is how I formulate my question. I think we need to go down and down and down that route using this and that algorithms in such a way that it will answer exactly what we really are after. So that's really the expertise element that we're trying to foster during the course, and not having you as becoming like the, the encyclopedia of all possible algorithms. But you have the culture after the course on understanding and navigate all these new developments and with a purpose, not just for the sake of it and for the elegance of using whatever new methods, but because we know it's going to add to the question. Sorry, I was a bit long, but that's really, really the DNA of the course. Now, a bit more mundane and a bit more quantitative. This is how it looks like. So these are the first cohorts of the course. So as I said, we started the course in 2018, where we had 17 students, some of whom, and Thomas, you were on the first or second one? Second one, okay. Um, where we had 70 students, some of whom are still with us. Then, as you can see, there was a increasing in number very quickly. So we doubled the size in the second year where Thomas came. Then we had a continuous growth during the pandemic. We had 43 students that were online. Then 2021, 22, we were in the high 30s. Then we had another increase in 23, 24 with last year's cohorts, which was the largest, with close to 60 students being enrolled. A number that I listed in the slides, which I've not referred to yet, is the number of applications that we get. So you can see we've got a large range of and a large number of applications, and we've got a little number of offers. So we are actually are a very, very competitive course. But if you're excellent and if you have motivation that is convincing and that we know that the course is going to help you fulfilling your professional aspiration, then there should not be any reason for you not to be enrolled. So competitive, yes, but if you're here for the right reason and you're very good, then you'll get it. Now, independently of the numbers and of the selection rates and so on, what was very important and which is a source of pride for us is that across all these years, we've been able to recruit a cohort of very, very vast and diverse backgrounds, which was really, really a pleasure to work with because there was really cross-fertilizing group work with people with different expertise and different backgrounds could contribute in a different ways to research project, and that was really, really, really a pleasure and really productive. As an example of this, quite a few of the research projects that were developed within the years turned out to become actual research papers. Now, current year's crew, same number of ish of individuals. We've got a low 50 number of students. We received a very large number of applications, close to 400 eligible applications, and 80, less than 90 offers were made. We're quite happy with demographics, where we have a vast majority of women. We do have people from all around the world. This year, we've got 20 countries from all continents being represented in the cohort. And again, very mixed backgrounds in terms of undergrads or professional expertise. We also have, which is, I think, a strength in the program, a large range of expertise and experience in the course. So this year we've got a bit younger, but still, every year we've got quite a few professionals that are enrolling the course and do a kind of a career switch. So that's bringing to the mix a very interesting element with a more maturity that helps the groups organizing the work in different ways. So that's really, really also a big feature of the course. So bottom line, we have a multicultural and multidisciplinary cohorts of students, which I think everyone, well, teachers for sure, and students as well, enjoy being involved in, because that's really a nice melting pot to be involving in. So that's about the students and the student life. Now, in terms of teaching and organization, so the course is split into three terms. So term one, which starts in October and ends in December, is, let's put it this way, a kind of a wrapping up, warming up term, where we have, as we said, heterogeneous expertise. And the idea is that during this term, people will learn to speak the same language, to work together, and to get the similar objectives. So this is done through a rather intense teaching schedule, where you've got 4.5 to 5 days of teaching a week, and you still have some independent study time during which additional sessions are organized. So typically, and that's a good example of how we manage the heterogeneity of the backgrounds in the course. So in term one, we have one supplementary and optional teaching on biomedical sciences. So that's how to put people up to speed with a more of a quantitative background, to make sure that they understand the language, they understand the questions, they understand the main issues and problems that you can face in epidemiology and life sciences. And on the other side of the spectrum, we also have more of a computational algebra, mathematical refresher, if you want. So these are the additional resources that we're organizing in term one. In term one, you've got five main modules that are being taught. So you've got Introduction to Statistical Thinking and Data Analysis. So this is a module which is led by Verena Zuber and David Muller. It's really for you to get up to speed on understanding the statistical methods and designs for epidemiological research. It's really founding and important modules. Students with more of a methodological background will feel that this is a bit of a rehearsal of what they've seen at length, but they will see it with a different angle, which is that of house data analytics. So there's still to be gained. It's not only a refresher, it is also a new way of looking at it. And for students with less of a quantitative background, this is a kind of a catching up module, if you want. The counterpart of this is Principle and Methods of EPI, where you will be introduced to the main methods, design, and concepts that you're going to play with in EPI. So that's more of a already known topic for more applied students, but more of a novel module for quantitative students. Then you have, and these two modules are quite interesting for you because they're shared with the other courses, the MSc in EPI and the MPH. So this is also a mingling opportunity for you with all the postgrad students in the school. Then you have three HTA specific modules, one on clinical data management, which is led by Thomas and Lucas Chang. It's really about database design, query, and maintenance, sorry. under the usual legal, security, and ethical constraints that go with clinical data. So that's quite important because that also dictates security and good practice in how to handle sensitive data as observed in health sciences. Then you have the molecular epi module, which is led by Professor Abbas Degen, which is really about introducing you to molecular data, so what we call omics data. So you will see all the main types of omics data. What do they what do they mean? Why are they useful? And how do you do some benchmark modeling and exploration of this data? This is an important module because some of the concepts introduced in this module, you will use them in term two, because omics data are a perfect example for challenging analysis. And in term two, you will see new models to explore and integrate these data. So this is important to understand what kind of tools you're going to play with in second term. And finally, there's the translational data science, which is a module that is taught half time in term one and half time in term two. So the first part in term one is really dedicated for you to gain the practical aspect of developing and implementing transparent, reproducible, and ethical research. So that's really about how to code, how to work in collaboration, how to make sure that you validate your results, that you're always able to reproduce any findings that you have, and if not, understand why. So that's really a core and important module for term one. Then term two is really more about a specialty set of modules. So you've got a bit less teaching, as in you have 1 day-ish free for independent study. Again, during these sessions, you may have some optional teaching, like here we have got some Python coding and some linear algebra again in term two, but also along the way, if we identify with the student reps that there's something that was not really well understood, we can sometimes organize ad hoc and bespoke additional sessions to make sure that no one's left behind with a concept that has been ill understood. This year, we also implemented, based on the feedback we had from our students, I will not lie, this is very intense. Our course is very intense. And to accommodate that, we've implemented in term two a week where people don't have any teaching. It's a reading week. It's time for the students to reflect back on the half term that just happened, make sure everything is up to speed, there's no loose ends and so on. So that's that reading week, which we've implemented this year for the first time. For this, we have four main modules. One is translational data science that you had half time of in term one. The second part of the module, which is led by Dr. Rodriguez and Semenova, is really group work. So you're going to be given real data sets with the real research questions and applying the rigor concept that you've been introduced to in term one and the methods that you will be learned in the three first modules that come to in a minute. You will be asked to go step by step from getting your data to writing your paper all along the way in group under our supervision. And then you have three specific and bespoke modules. One, which is new, and that's the first iteration this year on AI for health sciences. This is led by our colleague Lisa Semenova, and that's really to introduce you to the principle of AI, the different families of AI models that you have, explore the main algorithms that are out there. So all the buzzwords, you have them in the in these modules, but you have it in such a way that you're able to implement those, understand and critically appraise the results that they generate. So it's not like a I'm going to click, click, click and get my results. It's to understand which models, for what purpose, and what does it produce. Taking the similar approach, we're also introducing you to the main concepts and algorithms of machine learning. So that's the second module led by Dragana Vukovic. And again, with the same rigorous approach for you to understand the methods. So there's a bit of a theoretical background needed, and also implementation and interpretability. The final one is computational epidemiology, which I lead, which is exactly the same as the two first one, but instead of focusing on machine learning, here we're looking at statistical and some ML, but basically looking at large data sets like omics, but not only omics data. It's data we've got lots of measurements and sometimes in very few individuals, and try to see how you can analyze and produce some meaningful, reproducible, and interpretable results from this data. So you can see that you've got those three main families of complementary approaches, and you're going to apply them all in the translational data science. Now, during the course, you will also be exposed to project work. So you will have some project within the modules. So they are very, very tiny projects. So it's basically a real data set that is given, or a TOE example data set that is given during the tutorial session, on which you're going to apply the concept that you've just been taught, and you will sometimes be evaluated by an informal presentation and or report, but usually it's just for you to get exposed to applying these models and these approaches in real life. The actual project that is going to be fully assessed is the TDS. So as I said, you will be given a real data set with a real and unexplored research question. You will be supervised by the person who knows the most about the data. So that's usually us. And some of the TAs, module leads will also contribute to the supervision. And again, as I said, we'll take you from data cleaning to paper writing. This will be evaluated by group presentation with some individual elements and also an oral presentation, so report and presentation. And then in term three, which we've not talked about, there is an individual research project which takes you from April, May to September. So this is an individual work where you will apply all the concept that you've learned during the year, again on real data with a real research question, under the supervision of anyone that is providing these projects, and we're going to discuss that in a minute. And if this is an external project, there will also be co-supervision by someone from the school. This is no big surprise. That individual research project is evaluated by a report and by an oral presentation. Now, these projects, you can come up with your ID, you can come up with your own project. So you can come in the course, say, I want to work on this. And so we work together on identifying who could be a good supervisor and make it happen and set it up with you. You can come with more precise idea of, I want to work with that person on this. You've talked to that person, then in that case, you are asked to write a small summary of what the project is. We need to make sure that it ticks all the box of the learning outcomes from the course. Need to make sure that we have someone internal helping with the supervision, making sure that there's no mismatch between the supervision and the expectation of the course, and that goes. And you also have, as I said, a list of, we populate ourselves. A very long list of projects. Last year we had over 100 projects available for our students, and they're very, very wide range of projects. So there's plenty of opportunity to get exposed to those. These are examples which I'm not going to go through because they are they change from one year to the other. So these are, for example, some projects that were available. One thing before you ask, uh, we also welcome industrial projects. So we have a very large list of collaborator in the private sector. So that includes, of course, pharma company, biotechs, startups, banks, any kind of companies that we have regular contact with and who are very, very happy to supervise our students. So the list is getting even larger this year, with Thomas having made quite a few contacts with Ghana as well. So we have a lot of opportunities. And again, you can come up with your IDs and with your companies that you want to work with, and we try and make sure it happens. Again, as I mentioned, there's not only the taught terms and the lectures that we discussed. There's also some optional resources that you need to be aware of. There are some optional teaching. So I mentioned the mathematical refreshers. I mentioned the uh, bio biomolecular additional session, the Python sessions. So these are highly recommended to make sure that you're up to speed. You also have access to a very large range of seminars, including some on Bayesian modeling, which is not extensively covered in the course, but you have some of these seminars made available to you. And there's also keynotes that you are invited to. So usually these are very, very high profile people coming and giving a seminar to you and to the department. Uh, so that's a fantastic opportunity for you to ask questions, to realize what you're being taught now. Why is that useful for real research of contemporary research? And also, it's an opportunity for you to talk to people that are very difficult to reach usually. So, in terms of networking opportunities, this is an important event for you that you should use as much as you can. And to conclude, just wanted to list a few supporting structures that are being implemented in the course, because what we don't want is that your financial situation would dictate whether or not you can join the course. So we're trying to implement within the college some supporting structure. So there is, first of all, an application fee waiver. So you've got the link here to make sure that you can apply for free in case of a financial distress. And also, should you be offered a seat in the course, there are quite a few scholarships that are available for you. So some of them cover home fees, some of them overseas fees, most of them, to be frank, home fees. But yeah, visit the page and happy to discuss and support your funding application. That's it for the overview. So maybe we can now start, Thomas, with the questions. I'm going to stop sharing my slide.
Nice. Surprisingly, we currently have no questions in the chat.
Ah,
So we'll give you guys maybe a few minutes if you have any questions to type them in. Um, just briefly, I guess I would like to give myself as an example of following up of Mark's speech, that I was somebody who came from economics and I had done machine learning and data science, but I didn't know anything about biology. I was 30, I was working in investment banking, and so I was looking to make a career change. And so that was one of the big things that appealed about HDA to me, is that they would start me at the beginning in the biology side and help me level up there. The other really cool thing is the research project, because there's a list that you could choose from. I was always quite unsure of how I could come up with my own novel idea that would be brilliant, and it was a lot of pressure. But there's a great list you can choose from, a great supervision team, and then you can end up doing some really interesting, great research that is your own idea. So that was my whole rationale for picking it. But we're not all 30-year-old investment bankers. A lot of people in the course, like one of my course mates, Emmy, was a 23-year-old biologist who had never coded. So, as Mark said, if you're someone who's really interested in embracing this total skill set, it's a wonderful program, no matter what your background is.
thanks, Thomas. Do you have questions now?
Uh, so, for our application, what kind of experience should we talk about?
Oh, okay. So for your covering letter, so I think the experience that is important is the one that made you choose HDA as a course, so that we understand where you come from, how you got motivated about what we do, and importantly, what HDA will bring that will help you for the next step. So one is your experience that led you to identify a knowledge or a knowledge gap that we can help leap, and how that knowledge is going to help you for the next steps.
That's a great answer. Um, Could you please advise whether having a degree in biomedical sciences and currently learning Python meets the requirements for the course?
Oh,
Um,
I can easily do that. We have, I think, 25 to 30% of our students with biomedical degrees. So it fully qualifies.
And it's great you're currently learning Python. We should all code as much as we can, but we start you again from the ground floor in the program. And so actually last week was our big intro to Python week. And so don't feel that you need to be an expert programmer or even really know it to apply to the course, because we get you started with that right from the welcome material. Um, can a CS graduate with a couple of biology courses get into this?
Sorry, I didn't get that.
Can a computer science graduate who's
Yeah, of
only
course.
in a couple of biology courses get into the program?
Absolutely. We have some students who, well, Thomas didn't have any biology when he joined.
None.
We have Thomases in informatics rather than finance. We've had quite a few of students like this. Then they ended up doing actual very applied work later on. So absolutely. Just to clarify, I don't think your background is really relevant in the sense that the course is kind of self-contained. It will teach you what you need. The only thing that you need to have is be excellent and have some passion. And that's pretty much what will make you in the program. We've had some students that had studied history as well, and they did very well in the course. So again, it's really nothing to do with past experience. It's really about again, it excellence is important because we're competitive, but and it's also about really passion and interest.
And with the optional material, like the biology, you will, if you're a computer science person, you won't have to go to the optional Python stuff. So you can get some of that time to get really upskilled in biology. And that's the point of the first term, is that everybody gets to focus in on the bit they need to upskill on while still staying current with everybody else. So yeah, like Mark said, that's really not a big deal. I hadn't taken biology in 16 years, literally. It was no problem. So with 7 years of experience as a clinical SAS and SDTM programmer, how will this MSc in health data science help me expand my expertise and transition into a more advanced role within healthcare analytics or research data science?
Well, I'm not sure what you're doing currently in terms of applications, but clearly you will move a bit beyond clinical research. So you've got a lot of work on observational research, on survey analysis, on population-based studies, and so on. So you're going to get exposed to different questions which go beyond the scope of clinical research, and you will be seeing very different tools and approaches that are adapted to these studies actually. So a lot of cohort study, a lot of again population-based observational studies and so on. So that I think is going to help you. Second, you will be seeing you'll be coding in R and Python. So that's another skill that you will gain. And again, you will be acquainted to that culture of looking into the role of the environment. So we're very, very active in the exposome field. You will have some exposure to population health and so quite different range of applications and new models as well.
Mhm. Um, as someone who had a data science background, one of the huge appeals of this program to me was the omics data, because it's the biggest of big data problems. And so you're going to learn a lot of strategies that you don't see in a normal data science everyday application, industry, whatever. And so that will really kind of, again, as Mark said, up your skill in that area, as well as giving you a really nice scientific expertise. So in terms of eligibility, can someone from life sciences with a non-math background, learned independently with online certifications, apply and be considered eligible?
Absolutely. And even without the certification, you could. So yeah.
100%. There is math optional courses, but again, we are not going to have you do a bunch of math in the program. There's no complex proofs or anything like that. Remember, it's experts we're training, not people doing math for math's sake. As you have a mix of backgrounds, as you say, would you consider a psychology undergraduate who has a very strong background in research methods, statistics, data analysis, and wants to transform into more healthcare related fields?
I think we've answered this. Yes, absolutely.
Exactly.
Apply.
Uh, so, what are some possible career options? There we go. For the course, what did some previous graduates move on to do?
So, well, as you know, this is a very, very popular area. So our students are extremely employable, let's put it this way. So some of our students, even some who came with no intention whatsoever to continue in academia, have moved on to for a PhD. So we've got quite, including Thomas, quite a few of them have done that. Uh, some have also stayed in research, but at a research assistant level, and a large fraction as well have gone on into private companies. So in all the companies I listed before, pharma, banks, startups, biotechs, and so on, as data analysts, some others have also developed their own companies. It's extremely vast, and there's a bit of a focus on health related businesses when it comes to industries, but not only. I mean, people like our students a lot, irrespective of their area of application.
100%. Yeah, from my year, there were some people who were working as, obviously data scientists, research scientists, data engineers, stuff like that. But again, the amount of career fields is quite wide, and we actually have several talks in the course. One coming in week 10 about the careers that are relevant to each part of the course, so you can see what you like in the course and what you could do with it. But it is a very in-demand, transferable skill set. Okay, you said in the research project we could take our own ideas, but also that there's already some great data and research questions. Is there a route or some staff that are into working on neuroscience data?
Hmm. Sorry,
So basically, for
yeah,
the
yeah.
summer projects, could this person do anything with neuroscience?
Yeah, yeah, absolutely, absolutely. Again, it's either you know what data you want to work on, and we try to link it. So sometimes it's very easy because it's Imperial based data, so it's easy to make connections and so on. Sometimes it's publicly available. Absolutely, absolutely. And the idea is that we can even help finding a data set in the field, or we can help. Sometimes it works, sometimes it doesn't, including the researchers that you want to work with in the program. Usually it works, but it may happen that these people may be too committed in their own universities to do a collaboration. But usually it works.
Nice. Yeah, some students show up with pre-existing partnerships that they want to continue, like Alex with Stanford. And so we can enable that. Some people have rough ideas of people they want to reach out to, and we allow it. But again, if you don't have an idea, that's fine. We have a list of really, really great projects that are super interesting. I got mine from the list, and it was great. How is the course tailored for applicants from a medical background with limited or no prior coding or mathematical experience?
Well, very, very well. We've got a lot of students who were in that situation, and all the optional teaching that we discussed, and the teaching itself, which is again taking it step by step. So there's a steep learning curve, but it's not like you're confronted to a wall when you start the module. It's all gradually increasing in terms of complexity. So you're taking by the hand, and if you have zero experience, then you will still be able to go through the program without problem. It will take some work, of course, because there is no magic. So it needs work, but all the resources are in place to make sure that you can do it irrespective of your background.
100%. And we have around what, yeah, you said 20-30% of the program each year are roughly doctors who learn the coding, all start from scratch,
Yeah.
and then are in incredibly high demand because it's much easier to learn to code than it is to become a medical doctor. Any prior courses that we need to do in order to apply?
No, easy. No. And you have pre-reading materials that are actually optional. So I know students want to do their best to maximize the experience. So we developed these pre-course materials, which I was originally against because I thought you didn't need it. And I'm still thinking you don't, but I think it's more of a psychological thing that you want to do some stuff before starting. But this is optional.
100%. And so again, that goes for both. Once you have applied, there's no courses you need to do crash course to catch up. But also this question was kind of more about, is there any courses that I need as requirements on my transcript in order to be considered? And for that, the answer is also no, Mark. Or do they need to have a certain to apply? So like if I want to apply, do I need to have a coding course? No. A math course? No. But you need to be excellent. I think that's the only real hurdle you have to go over. Okay, as someone who's currently working on both projects and research papers, which is more relevant to the course? Systematic research papers or independent application-based impactful projects?
Huh. I'm not sure I understand the question, but so your expertise in working in research projects, if that's your question, is important. But again, you will acquire it during the course. So it's always a plus if you've done that already. And the yes, systematic independent application. Well, both of them are because the systematic research papers are helping in getting a landscape of what's happening. But this you will get from the course, and the original application projects are also about challenging your knowledge and confronting what you know to those unexplored questions. So I guess this is also a skill that you will gain from the
Mhm.
course. So I would say that not, if I understand the question correctly, you don't need not any of those for applying because you will gain it, but both are important skills that you could put forward in your application. Again, if that's your question.
100%. Okay, so what do you believe is the most challenging part of the course, or what students find the most difficult?
I think what they found difficult, but once finished, they really enjoyed and they were really proud of was the intensity of the work. Because it, as I said, and I'm not gonna lie, if you want to have an easy year, this year is not for you because there's a lot of work involved, a lot of group work, a lot of new concepts to dominate at some point, and so it's a bit of a challenge. You're never left alone and there's some group work it always done, I think, and the feedback we have is that it's a bit like when you run a very tough marathon. You're not necessarily enjoying utmost when you're in there and you're suffering a bit, but when you've done it you're really happy and proud, and that's what I think our students have fed back to us.
100%. Yeah, I would also add that if you are applying to this course, you are a very keen student, like myself. And so you love the intensity and you really enjoy it and it is fun. But because you're a keen student, you might want to learn 100% of everything the first time through. And there is a lot of material. And so again, it's just pacing yourself, consistent effort. But again, all the students absolutely love it in the end. Okay, I have an MBBS degree as well. I am a working professional with an MSF. One attendee asked a question related to MBBS. Could you please expand that part a bit more where one with MBBS cannot apply?
No, MBBS can apply. I'm not sure why you think no, absolutely apply.
Yeah. Yes, we have nothing against people with medical degrees. We love them, and they're all welcome to the program. And so again, what we want to hear is your story in the application of how does HDA help you go from your great medical degree to where you want to go. And so you're allowed to apply, please do. Um, okay, what do medics who enroll onto the course end up? So I'm assuming
So
end up
some
doing.
of them go and finish their medical studies. Some have finished and do clinical research. We've got quite a few of them. Some of them are going back to their specialty, but now with a data science hat on. And so they use this to, in their own practice on a daily basis, their generates some research project on the side of their clinical practice. So that's really a vast diversity of destiny for our MBB medical students. But
Mm.
what I guess the take-home message is that they do not stop their clinical work, and it is transformed by adding that data component to it through research or through their clinical practice. There's a large range of experiences, but it's a life-changing. That's what they reported, is that it's a life-changing experience that changed their daily clinical work.
Yeah, 100%. I will also add that there are a few medics in the course each year that do not want to continue being a doctor and they're looking for a career change. And two of them from the last year have been hired actually at the same company who are looking for doctors who can code because that's a really high demand thing right now. And so if you are a doctor who's looking to make a career switch, that is another possibility. But again, it's great for going into clinical research or just advancing your career. Um, yeah, the top paper this year was actually by a surgeon who's going to publish it, and that will advance his medical career. So that's quite cool. Okay, how do you see data analysis in ML expanding in the next 10 years down the line?
Well, that's a bit. I'm not sure I can answer this question in less than 2 hours, but basically, it's going to be a domesticate AI, make sure that you still continue to understand the decision you're making and make the most of the mountains, oceans of data that is flowing in, pretty much.
Yeah. That's been the big challenge of the modern era is that we produce more and more and more data. And so the data is getting bigger and bigger and bigger. And there's no bigger big data challenge than omics data. So it's a really valuable skill to learn. And that was in healthcare. Okay, so sorry. How do you see data analysis and ML expanding down the next years in healthcare? We might table that question because it's not specifically related to the program. But again, our as with all statistics, data analysis, and ML, it's going to follow the same trajectory that it has been. We will get more efficiency tools. It will be more accessible, but we'll have more data and it'll be easier to make mistakes. So experts will be in higher demand. Um, what can make an application stand out?
I think we addressed this. So mainly what we want is to make, again, it's very simple. What we want is to make sure that it's not a matter of deserving a seat because your excellence will speak for itself. It's just making sure that within the excellent people who are manifesting an interest in the course, that the ones that we're going to pick are the ones that are going to benefit the most of it. That's really what we're after. So what will make it stand out is an obvious reason for being with us.
100%. We are very passionate about teaching. And so if you are passionate about coming to go to HDA, that's going to be a nice match. But as Mark always says, anyone who's applying is excellent. So excellence, please. Um, can you please outline examination timeline during the course? Is there a written examinations, solely group presentations, a final individual research
Ah,
project?
so yeah, pretty much. So the idea is that for term one, you have mostly exams. Well, you have only exams. Well, in stats, you have some mini project, which is group projects, but the rest is written exams happening in the first weeks of January. Sorry. So, no, sorry about that. I should have closed my Teams. So yeah, term two, you have exams for ML, AI for Health, Compepi, and you have the project for TDS, which is a report and an oral examination. They have a group component and an individual component in the marking. And then you have the research project, which is assessed in September through a research project, paper formatted research project, and an oral presentation.
Okay. So that was the last question.
Okay.
Sorry, I take it back. There's one last one. Um, excuse me. Are there any department-specific scholarships or bursaries offered to international students? And how are students selected for the scholarships?
Okay, so there are some. I've put in the presentation the link to the funding page. To be transparent, overseas fees, there's less opportunities. You could find some beyond the ones that we're listing in the course, so you can have some foundations and so on. And how students are selected, it's really based on excellence. I mean, there are a few opportunities and quite a few applicants, so it's about excellence.
100%. And so, as Mark mentioned, please check out that link. International students are eligible for the same scholarship that the home students are, but just up to that amount that the home students get. But as Mark mentioned, there's other links on there for people from Black backgrounds or disabled students or a variety of people. And so please, yeah, take a look. A last question that I'll actually answer because we've answered it 10 times already, but just to follow up on a medical degree classification, what do successful applicants achieve? And what are you looking for in a successful medical applicant? So again, we are looking for you to tell us why you want to come to HGA. What's the purpose? What will we be able to help you do? We want to enable you. And so if you have a nice clear vision of that, that would be really helpful. Again, for the medical applicants, you can go into being a clinical doctor who is not having to practice as much anymore. You can go on to be a practicing doctor, but try to get up the ladder towards the top. You can go on to become a professor who is also practicing. Or you can make a complete career change and go into a data-heavy career where your scientific knowledge will distinguish you from all of the other candidates and put you right at the top. Okay, no more questions. So I believe that is all.
Okay, in that case, thank you very much for attending and for interesting questions. And well, you're welcome. And thanks, Thomas, for doing the duet as
Love it.
usual. And thanks, Joe, and thanks, Sylvia, for making this happen. All right.
Have a wonderful day, everyone.
Bye bye.